everyone, my name is Rose Ju, and I'm a student at River Bluff High School. Thank you so much for joining me today. My presentation is titled The Overlooked Impact of Food Additives in Global Health. Throughout this talk, I'll be sharing how a common part of our everyday lives may have deeper and more dangerous connections to chronic illness and global health than most people realize. First, a little bit about me. I'm a rising senior from Lexington, South Carolina, where I'm actively involved in a variety of extracurriculars that connect my interests in science, leadership, and service. I'm part of my school's HOSA chapter, where I recently placed sixth at the International Leadership Conference, as you can see on the bottom photo. I'm also involved in my school's DECA chapter, as seen in the right photo, where I was honored to be a top 20 international finalist this year. I'm also passionate about research, and the photo on the left shows when my team and I competed at our regional science and engineering fair, where we placed first in our section of biology and biomedical sciences. Outside of academics, I love playing tennis, volunteering in my community, and I plan to pursue a future in biomedical engineering or public health research. So, have you ever opened a bag of candy or drank a brightly colored sports drink and ever wondered what gives these foods their color? While the hues might make them look more appealing, there's growing evidence that these synthetic food dyes could be doing more harm than we realize. Two of the most widely used dyes in the world are red 40 and yellow 5, which are found in everything from cereals and sodas to chips and vitamins. My presentation is grounded in research I conducted with my team for ISEF, where we tested how red 40 and yellow 5 affect bacterial growth, a key indicator of gut microbiome health and inflammation. However, this isn't just a science project, it's a global health issue. Food is something we all share, but the safety of our food isn't equal across the world. Regulations on synthetic food dyes vary drastically by country. For example, many dyes are banned or required warning labels in the European Union, where stricter food safety policies have been in place since 2010. In contrast, the United States continues to allow these dyes in hundreds of food products, often without warning labels, despite studies linking them to behavioral issues in children and potential inflammatory effects. Globally, over 75% of processed foods in the United States contain artificial additives, including dyes, where in developing nations, processed food consumption has risen by over 30% in the past decade, especially among children. This uneven exposure, combined with limited healthcare access, creates disproportionate health risks for communities that are already vulnerable. And why does that matter? Because chronic inflammation is a major risk factor for diseases like cancer, which is the second leading cause of death worldwide. If widely consumed dyes are contributing to long-term inflammation, then this becomes a food safety issue, a policy issue, and a health equity issue all at once. To explore how synthetic food dyes affect bacterial growth, my team and I used E. coli as our model organism. Conducted at the University of South Carolina, we tested three dyes, red 40, yellow 5, and methyl green. The last one acting as a negative control because of its known antimicrobial effects. Using a 48 well plate, we tested each dye at three concentrations, 100, 200, and 500 microliters. For every concentration, we had two wells with E. coli and two without. This allowed us to compare actual bacterial growth with any background absorbance from the dyes alone. We also included positive controls that had E. coli but no dye, and blank controls with just TB medium. Each well received 500 microliters of TB medium and either 5 microliters of diluted E. coli or sterile medium, depending on the condition. Once the plate was set up, we used a plate reader to measure optical density, or OD600, every 20 minutes for 20 hours. These readings gave us a real-time view of bacterial growth and helped us see how each dye at different concentrations affected over time. For our results, red 40 showed some unexpected patterns. At 200 microliters, E. coli grew the most, higher than both 100 and 500. But at 500 microliters, growth flattened and became inconsistent, suggesting that higher concentrations may cause stress or toxicity. Yellow 5 also had a curious trend. The 200 microliter again led to the most strongest and sustained growth, even increasing later in the experiment. Growth at 100 and 500 were lower and more stable, indicating that mid-range concentrations might stimulate growth while others don't. Methyl green, our negative control, behaved as expected. At 500 microliters, it caused an early peak followed by a sharp decline in its growth, confirming its toxic effect on E. coli and validating our experimental model. The right graph shows a positive control that was E. coli with no dye, demonstrating consistent bacterial growth and contrasting the irregular and inhibited growth patterns observed in the dye-treated samples. Our data suggests that synthetic food dyes may stimulate bacterial growth at certain concentrations, as we saw in red 40 and yellow 5. These effects weren't linear, indicating that even small differences in exposure could significantly alter gut microbial behavior. Since the gut microbiome plays a crucial role in immune regulation, inflammation, and even mental health, disruptions caused by synthetic dyes could contribute to a wide range of chronic diseases, such as inflammatory bowel disease and metabolic syndrome to colorectal cancer. Understanding these effects are vital because synthetic food dyes are widely used globally but regulated inconsistently. As consumers, researchers, and future health leaders, we must take action on three levels. First, we should advocate for the mandatory labeling of synthetic dyes on all food products, including clear warnings when potential health risks exist, similar to policies already in place in the EU. Second, we need to push for increased funding and support for microbiome-focused research, especially in relation to food additives, to better understand the long-term impacts and guide public health policy. Third, we must expand public education initiatives in schools, communities, and even through healthcare providers to raise awareness of how diet, including artificial additives, affects gut health and overall well-being. Our findings highlight the need for more research into how food additives influence the microbiome and contribute to chronic diseases, a critical global health concern. Here are my information resources and my image resources. I'd like to thank my family for their constant support, ISEF and my teammates for the opportunity to present this research, and the Medical University of South Carolina for providing resources and guidance that made this project possible. Thank you for taking the time to listen. I hope this presentation leaves you thinking more critically about what's in our food and how small ingredients can have a big impact on global health. I challenge you to look beyond the colorful packaging the next time you choose a snack or drink and consider what might be happening inside of your body. Together, through awareness and advocacy, we can push for safer food systems and better global health outcomes. Here is my contact information. Thank you again.